Hi, I'm Angela Stribling, host of Pillow Talk with Angela on WHUR. Welcome back. You know, we are Facebook Live streaming because this is all for you. At any point, we want you to comment. You can come forward with your questions. This is Mayor Muriel Bowser's Maternal and Infant Health Summit, so we're going to impart some really good information. You might have noticed I've got some beautiful ladies sitting right next to me. I want you to each just give your name and what you do. Just quickly, if we can just go down the line.
Hi, I'm Nancy Gaba. I'm the chair of the Department of OBGYN at George Washington University, and I have the best job in the world because I just get to take care of women.
I love it.
Hi, I'm Laurén Doamekpor. I'm a public health scientist and a mom of a nutty, adorable 3-year-old.
And my name is Maya. I'm a DC resident, also a pediatric nurse here in Washington, DC. And I'm training for my first marathon this fall.
Ooh.
Hi everybody, my name is Gabby Martinez and I'm the co-founder and executive director of Tribe, an organization based in DC dedicated to the betterment of Black girls and women.
Okay, I love it. Well, welcome. So, you know what, keeping yourself together, being healthy. You know, we might not all have children, we might not be pregnant right now, but we can agree that we all deserve the best of health care. So let's just talk about that. And Maya, if you don't mind me singling you out to get us started. I know you're not pregnant right now, you might not even be planning to have a child.
No, not yet.
But let's just talk about the importance of leading up to that, you know, taking care of yourself and how it affects your pregnancy as well as having children, what you do at this stage.
So right now, I think that it's very important for myself to take care of myself, not just to adapt like fitness goals, but just to adapt a fitness lifestyle. Whether it goes from like eating a healthy meal or opting out from sugar and soda and chips and fries. That's like my weakness.
It's hard.
Yeah, fries is my weakness too. So just kind of making sure that I adjust to a healthy lifestyle, so it's not a chore. It's not something that my doctor recommends for me or my nurse practitioner, but I'm actually living day by day, making healthy choices, whether it's from training for a full marathon like this fall, which I think is crazy. I still can't believe I'm doing it.
Go Maya!
Or going to just pick a salad and just making healthier choices, making sure I'm visiting my doctors and getting those checkups and being proactive about my own health will help me learn the habits to be a good mom to my offspring and my babies, because then I'm already in that mindset and my kids will see that as an example as well.
I love that, and it's so important.
Right.
Anyone can chime in. Are there any things that have impacted maybe your pregnancy or having a child that you didn't even know it was going to have an impact?
Yeah, I can chime in on that. So I think, just jumping off of what Maya said, I think for me, the key thing that I didn't realize would make such a huge difference in my first pregnancy was working out. And so I was super active, you know, running marathons and, you know, doing weights before I got pregnant. But I realized that continuing that regimen, and my OB suggested that, you know, I continue that regimen, but continuing that regularly really helped. I had honestly a really smooth pregnancy, and I honestly think that was part of it. Yeah. Just being active, and even now I'm 4 months pregnant, and I'm older, and I'm heavier, and I'm more tired. But working out, it just gives me so much energy right away, and I honestly think that's probably the best thing that I did for myself.
And you're looking good. You
Thank
look
you.
great.
Thanks.
Dr. Gaba, I mean, what would you say is the link between eating right, working out, and pregnancy?
Well, definitely women who are healthier because they eat right, exercise, get pregnant more easily. So that's, for people who are struggling to get pregnant, definitely something that will help is being a healthy weight and having a healthy diet. I think there's also this myth that you have to be a marathon runner like Maya to be in good shape, and that's absolutely not true. Just get moving. Right. Women who are on the move, walking 3 to 5 times a week, just for half an hour with a friend, even that can make a huge difference in your health.
Definitely.
The key is not to worry about being the most fit person. The key is to just being the most fit that you can be.
Right.
So Gabrielle, what would you like to share?
Definitely. I definitely have to think about all of these precursors. I have stage 5 endometriosis, so that is already a reproductive health issue that I have to be wary of. But taking it back to even before thinking about having babies, even in learning about my female reproductive system, that part of like PCOS, endometriosis was kind of left out. So I didn't really know what to do to be preventative to take care of myself in that sense until I was older and had more access to healthcare and to those programs that literally talked about those things and gave me space. And also having competent doctors who wanted to have that conversation and dug in deeper with me. And so even before we talk about like maternal health or prenatal health, when you talk about pre-maternal health, you know, because if we're not healthy as girls and growing up, we can't grow on to be healthy women who then have to worry about reproductive issues because we're dealing with the circumstances or the issues that we've had before that never really got any care.
Yeah, very, very important.
Can I go back to something that Maya said before also? Partnering with your healthcare provider is so important. If you feel like you have the kind of relationship with them where you can talk about being proactive and learn about your body and learn about the things that will help you go on to have a healthy pregnancy, that's what it's all about. And if you're not in that kind of relationship with your healthcare provider, you probably need to think about that.
I completely agree. No shade, but I had a healthcare provider who I did speak to, and I am one of those people that like to call the worried well. I'm always at the doctor's. I'm always getting checked. I appreciate that, and I appreciate my access and my privilege to having access to healthcare. However, in my time dealing with some doctors, they, could be race, because of, you know, Black women and Latinx women are susceptible to mistreatment via medical care and pain management completely. So endometriosis has a lot to do with pain management. When I went to my doctors, they were really just more about prescribing me narcotics to treat the pill than actually talking to me about not having dairy, eating, you know, healthier and organic meats, and practicing yoga and mindfulness to deal with those symptoms instead of trying to mask them and not really treat them. So I appreciate the conversation of needing to have a good relationship with your doctors, but we also need to start educating doctors in a way that is more culturally competent to the care of Black women and women of color and just women altogether. Because a lot of times it's not that we're not going to the doctors, it's whether or not the doctors think that we're worthy enough patients to have those caring conversations
Isn't that something? And Dr. Gaba, you know, for other women who are going through what Gabby is going through, are there programs in place that people can just do their own research and find out that doctors can recommend, or what?
There's lots of resources for women who have pain disorders like Gabby's endometriosis, for sure. There are websites through the American College of OBGYN, the American Society for Reproductive Medicine. There are plenty of resources about that. I think, again, I'll go back to what I said before, having that relationship with a provider that makes you feel comfortable, asking questions, getting the help that's suited for you. It's not just one size fits all.
Right.
It's everybody needs to have their healthcare designed for them and their problem and their needs. So I would say working with your healthcare provider, feeling like a team.
Yeah, and I think it's super important, especially to have like affinity spaces like this where we're definitely just focusing on those things, because when we're talking about maternal health, it is bigger than just giving birth. There is postpartum. There's a mental health component that also goes into it as well that I don't think gets as highlighted or gets as much attention as it needs to when it comes to regards of like thinking about maternal health and infant health, because if the mother's not healthy, how can the children be healthy then too?
And there are different things you need to do at different stages. People are getting pregnant at different ages.
Exactly.
So let's talk about some of the health issues and, you know, maybe some things that you need to do if you're a little bit older and you get pregnant.
Or even younger. We talk about preventing teen pregnancy, but it's really just about like unintentional pregnancy. But unfortunately, during the course of teen pregnancy, a lot of the time, those girls are shamed, and so they're not really getting the health care or the best practices and those,
or the network,
you know, that network, that support
that
that usually pregnant women get a lot of times. So we definitely need to elevate those voices as well of, you know, the disenfranchised impregnated people.
Well, and people also have a lot of bias or preconceived notions about teenagers who do become pregnant and how they became pregnant, and we need to get beyond that and just take care of those women and help them. The other issue is what happens in between pregnancies. That's a real opportunity for us to maximize people's health care, and it's a missed opportunity. We sometimes call that the fifth trimester or the fourth trimester, depending on, you know, what you're talking about. But the fourth trimester is, okay, so you've had your baby, maybe you had high blood pressure during your pregnancy, maybe you are going to be a little bit older with your next pregnancy, like somebody I might know. You know, those are real opportunities for people to kind of take stock and figure out, okay, moving forward, what can I do that will make me healthier? And sometimes that's pregnancy prevention, and sometimes that's just maximizing health for a better or healthier pregnancy the next time around.
And okay, so this time around you're older than you were when you first got pregnant. So are there big differences in what you do? Do you take more vitamins, or what do you do now?
Not necessarily. I mean, like I said, I am older, and I do feel that. I do feel it. I am heavier. I'm just as healthy, but I'm not as active because honestly, sort of making sure that wellness is a part of my life is a lot harder with a 3-year-old running around, and there's a lot less time. So I'm finding that anything that I do in terms of, you know, eating healthy or exercising has to be coordinated, it has to be organized, and it just takes so much more effort. And it can be done, and we do it. My husband and I think we do a really great job. But I mean, the goal for us is really to model good wellness behavior for our daughter. So I do yoga in the morning, and she wants to do everything mommy does, so she does it with me. She doesn't do it right, but that's fine. And she's like running all over the place, but you know, and then we go for walks. She's in soccer, she's in swimming. So our goal is just to make sure that she knows that, you know, being healthy, eating well is an important part of what we do as a family and an important part of who she should be as an adult.
That's so good that you said that, because I was wondering, I don't have children, but I'm thinking, okay, once you do have a child, that doesn't mean your daily workouts have to stop. You can find a way to incorporate your new life.
Right. It's
get your
harder,
child
but
to
it can be
exercise
done.
with
Yeah,
you.
absolutely.
And modeling that for the next generation is so important.
Right, and again, it's like if you're taking care of yourself, like your kids will see that. Like, oh, mommy has a doctor's appointment. I have to go with mommy to the doctor's appointment. Mommy has a yoga class, or mommy has or we're gonna go running in the stroller. Like I know a lot of my girlfriends run with their strollers, with their kids inside, and the kids like love it. You know, it's like incorporating them part of your workouts and part of that healthy lifestyle. I know makes a huge difference, and it makes it more so like a family bonding as well. It's not just
that's another good benefit.
It's not a chore. It's a family event. Like, oh, we go to races, we go to, you know, mommy and me go on a run on Wednesday nights, for example.
Exactly.
That's nice.
I think it's super important specifically to model that healthy behavior, but also to model that healthy relationship between your doctor and yourself, to see that medical consumerism being put to use, and for your kids to see how you can have that conversation with your doctor. I think for too much, like, we fight for the right to access to healthcare, but we actually, when we get it, we don't use it the best way.
And I'm so glad you brought that up, because one of the reasons why I'm so glad that Mayor Bowser's having this summit in the first place is that I think there's a lot of mistrust of healthcare providers, that for some reason people don't believe that we have their best interests at heart, don't think that they're stepping into a doctor's office who really cares about them, and that is heartbreaking for me.
And I think that comes from, like you were saying, Angela, the one-stop shop fits all situation, where I've realized in having, again, expanding my knowledge and my use of my medical landscape, I've realized that I have a choice about who I see as a doctor, and I can read on them, and I can read their articles on like how they feel about certain treatments and measurements and things like that.
And ask questions.
And I can ask those questions, and that is my choice as a health consumer, and my choice to make longevity decisions for my health with somebody who I think will be equally committed to it as me, and not just, you know, a patient they see, but somebody that we can have a relationship with.
And it should be a partnership, right?
Yeah, right.
You know, it's not just a unidirectional thing where the doctor's telling you, now do this.
Exactly.
It should be a thing where you're saying to the doctor, here's what's important to me, here's what, you know, I value, and how can we make that work for my diagnosis or my pregnancy or whatever it is.
And I think that's backfired against us in the community or culture-wise, because people want to pass down stereotypes or myths about pregnancy and like the non-necessity of doctors.
Which is another reason that relationship is so important, and it needs to be developed. Right, it's essential. Ladies, thank you so much just for your time and sharing your stories. And you know, we are Facebook Live. You can comment. I know you learned something, but if there's something that you want to know, all you need to do is ask a question or just share your story. Thank you, ladies, so much.
Thank you.
This was fun.
All right, we're not gone. We're just going to take a quick little break, so you make sure that you come back.